All right. Well, what I'm going to try to do is just go over the changes that are now set. When we talked prior to May, there were lots of options out there. There was lots of reaction from when we first brought a proposal to the church in late October, early November of last year, stemming out of the need to be cautious going forward at the rising costs of healthcare coverage, and that the due base that churches are paying, how that base has got to cover our claim costs. Just by way of stating the obvious, the Board of Pensions covers its employees, those in the plan, by the money that comes in from the churches as dues. So it's what comes in, goes out and gets paid in claims. We don't do any other insurance, we're self-insured, and we've got to try to make that work, what comes in and what goes out. There's some reserves which we use when claims exceed the premiums that come in, but the projections were looking pretty grim going forward as to the amount of reserves we would need to use in the next 4 to 5 years going forward. Things changed a little bit at the beginning of the year with a very good year-end results, both on the reserve finances and on healthcare costs, not turning down, but at least staying pretty stable, we think. And claims to the board at the year end for 2012 were less than were expected 2/3 of the year through. So that was healthy. The church spoke, you spoke, congregation spoke, Presbytery spoke to the board in reaction to its first proposal, saying, are you serious? Is there not another way forward? And so the board, promising to listen to all the comments and looking at the figures, recrunched them, and then came forward with the proposal that you may have heard as option A, B, and C. And then those options, if you want to quickly look at them, were here as possibilities going forward. And so those options, if I go to A on the screen, option A, which was put before the church, was in 2014, just keep everything the same. But the costs would go up. The medical percentages would go from 21% to 23%. They would then go in 2015 to 24.3%. That was option A. And then option B, which really came off the table pretty quickly at the end of the day, was a kind of mix and match where we were thinking of charging dependent members, dependent parties to the plan, some contribution. And those are the figures that you see on that screen. Maintaining the cost of the congregation for their pastor, for their designated person who had to be in the plan, the mandated person, 21%, and then the remainder, 2%, being mixed up with possibility of the church paying it or members paying it. So that was option B. And then option C, which is where we're close to finishing, was a mixture again of 23%, 21% charged to the church, with the option of 2% being shared costs. So what transpired in May at the directors' meeting was this conclusion. In 2014, there are no changes apart from the percentages. So it's as is. It's going up from 21% to 23%. The other thing that's going up, and it doesn't affect those present this morning, I don't think, but some who may be watching this on YouTube, the minimum base for the dues is going to be set at $42,000. At the moment, if an effective salary is below $40,000, the church is calculated their dues as if it were on 40,000. Next year, 2014, that base is going up $2,000. So small salaried churches, the dues are going to be based as if they were 42,000 as effective salary. So it's 23% of 42,000.
Is it 42, is that their salary or does that include their housing?
Well, that's effective salary. And effective salary does include housing.
Okay, that's it.
Yeah. Doesn't include the cost of the health benefit,
Got it.
but it's effective salary, which is housing. So 42,000. And that makes quite a considerable change to the big pot, the money that comes in, moving it up. It's going to move it up again in 2015 to 44,000, and that's been decided. So it's a jump in 14 with another 2,000 jump in 2015. The percentages, instead of being 21%, are going to be 23%. And as regard the coverage, there's no change in coverage. And the covered member, along with dependents, are all in that, as is the norm today and has been since the plan started. So the pastor and all dependents, the lay person and all dependents are in the plan, if they're in the traditional plan. So it's a 2% increase. There are small changes to the medical plan in that day-to-day costs for drugs are changing. And so to fill a prescription for a generic drug, at the moment it costs the plan member $8. In 2014, that's going up to $10. If they do mail order drugs, the 90 days, at the moment the 90-day coverage on a generic drug is $20. Kind of maintenance medication is $20. In 2014, that maintenance medication, if we may call it that, is going to be $25. So $10 for a 30-day prescription. Mail order 90-day, 25. So it's a saving. If you're on a maintenance medication, we urge members, we cannot insist, but we urge them to do the mail order. It's cheaper for the board, it's cheaper for them, in that sense. So those are the main changes that are happening to the plan. The plan has also decided that a bigger change comes in 2015. Bigger only in the sense that this is radically new. And part of the word the board heard from the church was, we can't make all these changes so fast. We're not ready to make those changes. Even though you tell us in May, our budgets and our planning for January, it's just too short a time frame. So the board, in hearing that, have gone to a kind of a two-step program. First step, 14, it goes up to 23%. The biggest change, it's not radical, but it's change in how we operate in 2015. Here are the costs for 2015. The dues goes up from 23% to 24.5%. But the church can share part of the cost of that 24.5%. 23 of it will be for your mandated position, your pastor, or your person who's in the plan. The member who's calling the employed member will be charged 23%. Dependents, should there be any, and want to be in the plan, that's the extra 1.5%. And that 1.5% is quite small, but churches will have the freedom to pass that whole increase to the members' dependents to be covered. They can share it, they can pay it all, they can pay none of it. What this is doing for the very first time is offering a church a little flexibility and offering a family a little flexibility. At this moment in time, there is no flexibility. A pastor, let's call him a pastor, they are in the plan, their partner, spouse, dependents are in the plan. They cannot opt out of it, they're covered. That partner, spouse, or dependent may well be in another plan because they may be working. So they've got two plans going. In 2015, the dependents can choose to waive this coverage and be out of it. So if there's a pastor with a working partner, the partner has got good coverage from their place of employment, they can opt not to be covered by the Board of Pension. And the church will not be charged that 1.5%. It just comes off. So there's a little saving. It's flexibility, which we didn't have before. It's not a lot, but for some it's significant. So those is the change that's coming in 2015. Along with that, a more significant change is what we call the Call to Health initiative. Some of you are in the professional workplace and you're employed and you may well have incentives in your health benefits coverage if you do certain things, if you have a wellness program. And some people have been asking for quite a long time, why doesn't the Board of Pensions make a drive towards a wellness program? So here is the initial plan being rolled out later this year to come into effect in 2014. There is a wellness program, and if I can just go to that here. Come up. Call to Health. So the goals of the Call to Health: to improve member health, to sustain that effort, to give some rewards and consequences for doing it and being part of it, and it's not going to cost anyone to be part of the wellness program. The timeline is as on the screen. In 2014, we're going to define and monitor health actions. So what health actions you take in 2014 will make a small difference to your health costs individually in 2015. It won't change what the congregation is billed. It's going to be a change in the deductibles. Basically, if you take part in the Call to Health program and you do what is asked of you, your deductible will be reduced. If you do not do what's asked of you, your deductible will increase. And it's very, very small percentages. The deductible will be reduced in 2015. At the moment, it's calculated in a band of 1.25% of salary. It'll go down to 1%. And if you don't take part in the plan, it'll go up to 1.5%. So we're talking very, very small numbers.
Edward, what kinds of things are going to be included under that?
Yeah, I have them listed here. You got to complete 2 of the following health actions. You've got to have a health assessment, which is an online action or a telephone thing with Active Health. So that's one option. Remember, you need to complete just go back to my sheet. You need to have a preventative exam, so your annual physical. Okay, or well woman exam. You have to engage with an active health nurse if you're called upon, if you have a chronic condition or health risk. Okay, and then you do 2 of these that are on the board here. 2 of those: a health assessment, a know your numbers, a vision exam, take part in tobacco cessation program, obviously if you're a smoker. And if you're invited to attend a credo, if you do a credo conference, that covers one of those bases. So it's pretty wide. I mean, lay members will not be invited to do credo, so that drops that one out. But a lay member has got all those, and there's no cost apart from the vision. It does cost you $25 to go and get your eyes tested. So it's very, can I say it, straightforward, simple. We're not raising the bar very high here. We're just trying to say to our members, take care of yourself. Take part, do your annual physical or well woman's exam. Engage with active health when called upon to do so. And then do 2 of the following: the online test, kind of regular blood lab work that you would probably do anyway if you're doing your annual physical. So if you do your annual physical, that's done. And your blood work for your annual physical will more or less cover the know your numbers. So you're done. You have to do it. The dependents in your coverage plan do not. But you, the member, if you are the member of the plan, you need to do it to reduce that deductible going forward. So it's, again, very, very straightforward. Nothing radical.
Point
We
of
don't think
education
so.
for me, this is just for the healthcare. There's a other contribution for retirement plan,
The
correct?
retirement plan, and that's fair, Keith, that's the whole, you'll probably see the whole figure as another 12%.
Okay.
12% is pension, death, and disability. It's actually, there's 2 figures in there. It's 11% is pension, 1% is death and disability. We normally associate them as 12%. And so those figures have never changed and will not change going forward, at least in the next 2 years. The good news on the pension, can I give good news? The pension is as solid as Edinburgh Castle. It's just an incredible plan. So much so that we're fully funded at a rate today, and it's changing by the month because the market is raging, but at this moment in time, the Board of Pensions pension plan is funded in excess of 120%. It's close to $8 billion is working daily for the Board of Pensions. And that brings the other change that has come about since July, in that for the last, since 2008, there has been no increase of pensions because of the market situation. And there is now an increase, what we call an experience apportionment. So anyone who's in the pension plan and earning credits, their credits will increase by 1%. If they're retired, their pension increases. At least their credits are going to increase that 1%. So they get a 1% increase as of their July pension check this year. It used to be that apportionment increases would maybe be 3% or 4%, or some years 0, some years they were 8 and 9%. When we go back and look at the market and what it was doing in 1999 or 2000. The rule of thumb was that if the pension fund is funded more than 125%, they can share the wealth. The directors can make a decision to increase everyone's pension credits. because that was set as the rule, pension plans since 2008 have not been at 125% funded because of the dive or the dip or the crash, whatever you call it, of 2008. So they've changed the rules a little bit to say that going forward, if the pension fund is now funded at 110%, they can make a 1% increase. And then it goes up a little bit. They can make a 2% increase if it's 120%. And then if it's 125, it's over to the directors to decide. So we're back on healthier terms. What they're saying is, we'll probably have more often have 1% increases along the way, not big jumps. Keith?
So